What are culturally and linguistically appropriate services? Delivering culturally and linguistically appropriate services, CLAS, is as important to patients' mortality, morbidity, and quality of life as clinical interventions and treatments. The National Standards for Culturally and Linguistically Appropriate Services, CLAS, is a framework that serves as a guide of 15 implementation strategies for healthcare providers to advance health equity, reduce health disparities, improve quality of care, and deliver the right care to the right person in the right way. The 15 national CLAS standards are organized as one principal standard and 3 themes. Principal standard: provide effective, equitable, understandable, and respectful quality care and services that are responsive to diverse cultural health beliefs and practices, preferred languages, health literacy, and other communication needs. Theme 1: Governance, Leadership, and Workforce. Advance and sustain organizational governance and leadership that promotes class and health equity through policy, practices, and allocated resources. Recruit, promote, and support a culturally and linguistically diverse governance, leadership, and workforce that are responsive to the population in the service area. Educate and train governance, leadership, and workforce in culturally and linguistically appropriate policies and practices on an ongoing basis. Theme 2: Communication and Language Assistance. Offer language assistance to individuals who have limited English proficiency and/or other communication needs, at no cost to them, to facilitate timely access to all healthcare and services. Inform all individuals of the availability of language assistance services clearly and in their preferred language, verbally and in writing. Ensure the competence of individuals providing language assistance, recognizing that the use of untrained individuals and/or minors as interpreters should be avoided. Provide easy-to-understand print and multimedia materials and signage in the languages commonly used by the populations in the service area. Theme 3: Engagement, Continuous Improvement, and Accountability. Establish culturally and linguistically appropriate goals, policies, and management accountability, and infuse them throughout the organization's planning and operations. Conduct ongoing assessments of the organization's class-related activities, and integrate class-related measures into measurement and continuous quality improvement activities. Collect and maintain accurate and reliable demographic data to monitor and evaluate the impact of class on health equity and outcomes, and to inform service delivery. Conduct regular assessments of community health assets and needs, and use the results to plan and implement services that respond to the cultural and linguistic diversity of populations in the service area. Partner with the community to design, implement, and evaluate policies, practices, and services to ensure cultural and linguistic appropriateness. Create conflict and grievance resolution processes that are culturally and linguistically appropriate to identify, prevent, and resolve conflicts or complaints. Communicate the organization's progress in implementing and sustaining CLAS to all stakeholders, constituents, and the general public. Implementing national CLAS standards in the dialysis setting. To operationalize national CLAS standards, dialysis professionals can use the implementation checklist for the national CLAS standards. First, review each practice or standard from the checklist and self-assess your dialysis facility's current actions against the practices listed. Determine if your facility is currently implementing specific practices, or planning to implement or not implement particular practices. Assessments should not be performed alone, but instead should be conducted as a team activity with multiple members of your staff. Involve patients and families in this activity. Don't overwhelm the team by choosing too many practices to test and implement at once. Decide on 1 to 3 practices your facility would like to implement. Develop a clear plan that includes which staff will be responsible for implementing the practice and a time frame for implementation. Remember, although there are 15 national CLAS standards, not all of them will be applicable to your particular setting, for your distinctive patient population. Understanding the needs of your patients is important to the process. Consider how success will be measured. Consider Standard 14. Create conflict and grievance resolution processes that are culturally and linguistically appropriate to identify, prevent, and resolve conflicts or complaints. Success for this standard might be, in part, measured by the number of staff who completed a cross-cultural communication training by a certain date. Lastly, not all change is an improvement. Monitor the changes, both good and bad, that you see as a result of implementation. Take time to adjust, abandon, or adopt changes as needed. For more information, please watch Using Culturally and Linguistically Appropriate Services to Improve Delivery of Care, or contact us today.